The biggest thing that comes to mind when thinking about the 2020 elections and public health would have to be universal health care. Right now I think that's the #1 issue that most people are talking about, and I think that's one thing that's really going to drive voters' decisions when deciding who to vote for in 2020.
The issues that are important to me are healthcare, health coverage, universal healthcare, Medicare for all those things. That's very important to me. Reproductive rights, access to reproductive rights, women's health care, children's rights. All of those things are important to me, and the way that I'm involved is that I teach, and so I talk about these issues in my class. I encourage my students to vote and to be critical with the things that they see and the things that they read.
I live in a rural place. I'm very involved with maternal and child health, and obviously I'm very involved with aging and public health. All of these issues are real, but what really is most important is community-based control. Whether you live in a mountain, urban, rural place like I do, or in an urban inner city place, we need to have issues that reflect our specific needs. So the most important issue is having local control.
In the 2020 election, I care about immigration reform and immigrant health. And what I'm doing about it is conducting research to improve immigrant health, as well as advocating for the rights of immigrants to healthier conditions, particularly when we have a time where there's a lot of anti-immigrant rhetoric, and I think that as public health professionals, we need to do something collectively to address that issue.
The most important public health issues to me in the 2020 election is the opioid epidemic, focusing on harm reduction and treatment stigma.